Good evening, everyone. This is Sonia Liebendorfer, and I want to tie up all of the ends today. We've been talking about dementia and the different types since way back in September we started this journey. And we're going to wrap it up tonight by talking about the different mixed types of dementia. And I picked this presentation for a reason. Do you see this beautiful sunshine in this picture? Isn't it beautiful? Wouldn't it be nice just to see a beautiful sunshine like that again? I tell you, it seems like there's been nothing but cloudiness and a lot of really gloomy weather here lately, and it just seems like that it would be such a blessing just to see the sun itself without all of the clouds in the sky. Praying for a clear day so we can enjoy that one day soon. Let's go ahead and get started with the mixed types of dementia. Without further ado, here we go. Now, in the presentations over the past few weeks, we've covered all of the different types of dementia. And tonight, we're going to kind of put all those pieces of the puzzle together when we're talking about mixed states. Because we're talking about when people have different types of dementia, but we don't really have a full understanding of which one that they had first before we found out about another one. The most common type of mixed state is Alzheimer's and vascular. And the second most common type is Lewy-Body and Alzheimer's. And the third most common type is Alzheimer's, vascular, and Lewy-Body. So we are going to be going into all of these. Of course, we will review the fact that Lewy-Body can only be diagnosed post-mortem, and that's why it is so hard to diagnose because you have to actually stain the blood cells for it to show up post-mortem. So that's the only way that their presence is revealed. Because they are see-through, that's the only way, the staining is the only way they show up. So that's why our understanding of the order of the appearance of some of these dementias is kind of questionable. But we're going to go into these mixed states and we're going to go into the things that kind of run us awry in terms of being able to pick up on another problem. I want you to pull it out of your memory bank now. Alzheimer's. Do we remember the two causes of Alzheimer's? And for vascular, do we remember the cause of vascular? Alzheimer's, the causes are either the tau tangled proteins or the beta amyloid plaques. And for vascular, it's due to some kind of occlusion of the blood flow in affecting the way that the nutrients can get to the cells. And so, not getting any nutrients, the cells start to die. So, those are the two types. So, when you have a combination of these types, and one of them, for whatever reason, doesn't get diagnosed until after the fact, you have to look at the whole picture now. Which one came first? Did the blood flow problem come first? Or did the Alzheimer's come first? And sometimes those things are difficult to differentiate, and sometimes the symptoms are difficult to differentiate too. We are going to go over a brief review of that again, just to give you a pull together overview as we finish this session, to give you an idea of how these things can happen. Okay? All right, so let's go over again some of the symptoms of Alzheimer's disease. And then we're going to go over the signs and symptoms of the vascular again and really compare these two and see how some things might overlap that might cause some difficulty in diagnosing the problem. Of course, the biggest thing could be that somebody may have had a ischemic stroke, which is a stroke caused by a clot. And if they did not have an MRI within 24 hours, then they don't know, the people don't know that they had a stroke because they didn't do the follow up MRI. So that's why I always say that MRI 24 hours after you think somebody has had a stroke is important because if they have had a clot, the damage to the brain is not going to show up right away. It's going to take some time to show up. So you have to do the follow up MRI for that to show up. If for some reason that part of the puzzle is missed and a follow-up MRI is not done within after 24 hours of having the CT done of the brain to rule out any kind of stroke, then you may think the person is fine and does not have a stroke, when in fact they have had one, but we didn't do the follow-up MRI, so we don't know. So those kind of things are what you have to look at as far as a missed diagnosis. Now remember, Alzheimer's is when you have somebody that repeats statements, keeps saying the same thing over and over and over, asks you the same questions over and over. They forget that you've had a conversation with them and they'll bring it up again. They forget about doctor's appointments. They get their times mixed up, but yet they'll remember it later after the fact. But it'll be too late then because they won't remember that they went. They routinely misplace things and put things in illogical locations. Remember, I told you how my father told me that my mom was cutting up the apple for him because of his Parkinson's. He couldn't manage slicing an apple for himself daily. So she was slicing up the apple, but she was putting it in the china cabinet instead of putting it in the refrigerator. And so he clued me in back before he died in 2013 that things were going awry with her before he died. They tend to get lost in familiar places. Remember, I told you the story about my mom going to doctor's appointments. She's been going to doctor's appointments for years to the same physicians in town, but yet she would drive past where she was supposed to, or she wouldn't drive far enough. And the reason that we found out that this was happening was we put the GPS on our car. And they get to where they forget the names of the family members and the everyday objects. So they call it something else. And it can be just calling something it instead of referring it to what it is, a pen or a pencil or whatever. They forget the name, so to try to cover it up, they just call something it to try to cover the slip of the memory. Then sometimes they have trouble finding the right words to identify something or say something, and they find it difficult to participate in conversations. Well, this can actually be a sign of a stroke as well, because there's something in a stroke that's called expressive aphasia. And in expressive aphasia, you have difficulty in calling a right word for something. You have a difficulty, if you see a scarf, you won't think of the word scarf. You may think of the word tie. And you can never call it by its right name. No matter how much you try to say the right word, it won't come out right. I had an experience of this with this after I hit my head in a swimming pool, swimming laps. And I was doing the backstroke and didn't feel the wall. Went to go and do another stroke, doing the backstroke, hit the wall with my head, had a concussion, and I had a period of expressive aphasia for about 6 weeks. And they called it post concussive syndrome, where I could not say the right word for the life of me. I knew what I wanted to say, but I just could not say the right word. And you talk about frustrating. when you can't communicate and you can't say what you want to say, it is extremely frustrating. And it was to the point that I was writing things down, writing down the right word because the wrong word was coming out. And it was just kind of tricky because it would come and go so fast. But there was no rhyme or reason to it. It was just out of the blue. It was just all of a sudden hit me. So I had to be careful, at work, making sure that things would come out the right time. Can you imagine giving out discharge instructions to somebody in the emergency room and have that problem crop up and you say the wrong thing? Would not be a good day. So anyway, I had to be really careful for those 6 weeks to make sure that, everything was coming out right because it just hits you that way, that expressive aphasia does, that you just cannot get the right word out no matter what you do. And it's extremely frustrating. But it's easy to see how that, a symptom of a stroke, could be confused with somebody that's just having trouble finding the right word to identify something or say something. It's really important that you rule out by a CT and then 24 hours later an MRI to make sure that they have not had a stroke that has a clot that's been thrown. Because if they do, then they can't get that brain back once that tissue dies. And I'm going to show you a picture of that in just a second. All right, so we identified one area of confusion where there could be a problem with Alzheimer's when somebody starts to have expressive aphasia and can't get things out. Why we may think that it's a vascular issue because they kind of overlap. Well, let's look at some of the symptoms of vascular dementia and see how those kind of overlap with the Alzheimer's. They have people with vascular have problems with confusion. Well, don't people with Alzheimer's have problems with confusion? We've mentioned they have problems with days and times and keeping things straight and appointments and things of that sort. We mentioned that there's problems with dementia, with vascular dementia, with trouble paying attention, have difficulty concentrating, and that's also a huge problem um, with Alzheimer's is them being able to stay focused on something. But it's more so a problem with vascular, depending on where the problem is in the brain. Now, also, they can have a reduced ability to organize thoughts or actions to know what they need to do, steps first, second, and third. And you can also see that in Alzheimer's, but it's farther on down the line. Now, a decline in the ability to analyze a situation. Like we said, the process steps with vascular are what's missing. Be able to develop the plan, be able to convey it, and then be able to act it out. Steps one, two, three. They have trouble with that, processing that thought as to what they need to do first, next, and last. Then difficulty deciding what to do next. Well, I think we all have that problem sometimes when you're overwhelmed and you don't know where to begin. But in this instance, it's just a really point of anguish for them. Every little thing becomes so overwhelming. Like, for instance, today I was talking to my mom, reminding her that we have doctor's appointments we have next week, and that reminding her every day to make sure that she has this ready and this ready. And you have to just keep reinforcing that every day. And hopefully it'll click. Sometimes it does, sometimes it doesn't. And then problems with memory, especially short term memory, you start to see those with vascular dementia. Well, you have all kinds of that with Alzheimer's, um, with the memory problems and being able to remember how to get to the doctor and remembering how to get back. So just keep that in mind that there's a lot of symptoms here that tend to overlap, and that's why it gets to be confusing when it comes to diagnosis. Obviously, in these cases, the best thing to do is going to be able to make sure to follow up after a CT and after a MRI within 24 hours. Make sure it's close to that 24-hour mark, because if you do them too early, it won't show up. But make sure you follow that up with neuropsychological testing, because if they have an early onset, as my mother did last year, they said she was early onset. The CT said she was moderate, which makes another reason I think she has both. Because the CT showed she had moderate atrophy of the brain already. So I think she has both, but they only diagnosed her with the one type, vascular. So this is when she tested and did everything with the neuropsychologist, everything came back vascular. She wasn't showing any of the signs of Alzheimer's with them yet. So I just want to make sure I make that distinction, that make sure that you have a CT, make sure you have an MRI, and make sure you get the neuropsychological testing done. It usually takes about 2 hours for them to do all of the tests. And I was worried about my mom having the stick to itiveness to get all that testing done, because she gets very short fused if things are not going right. So I had to really play it by ear and see with that appointment. I wasn't sure how well she was going to do. She ended up doing fine. But my point is, you just are constantly walking on eggshells with them with vascular, because you don't know what's going to set them off, because they get very volatile emotionally once they realize that they're losing their faculties. They just turn on the aggression and the combativeness. So just be prepared for that if you encounter it, because it's unlike anything I've ever seen. So let's continue with the vascular. All right, and this is the other things that you can see with vascular. Like I said, you'll see the restlessness and the aggressiveness and agitation and increased frustration that they do take out on you, because you are a convenient target. Believe you me, it will be taken out on you, so you better don't turn your back on these people. I'm telling you this from experience. You don't turn your back to them, because you know you will not know what's coming next. You have to be worried about unsteady gait with them, because they'll get to where they're having more and more difficulty walking. My mother initially was just using a cane, but now she's having to use a walker. And it's getting to the point where she's not even going to be able to use that much longer, I'm afraid, because her gait is getting so slow, so very slow, that I think she's just getting too unsure of herself anymore to be able to walk with a walker. The other thing you see, incontinence. Incontinence becomes an issue. Now, incontinence becomes an issue first. They have incontinence of urine, but then they develop an incontinence of stool as well. And those are farther along down the line that you see those. They also have problems with depression. My mother used to go to church services religiously. She never would miss a church service. She was there every day, every time the doors opened, she was there. She got to where, as she realized she was having problems, she started to withdraw from everybody. She started to withdraw from church. She started to withdraw from her friends. She started realizing that she was having difficulties with remembering things, and she was not wanting to lose face with her friends because she was forgetting. So she just stayed at home and felt sorry for herself and would sit there and cry. And I told her, I said, Mother, we have to do something about this. You cannot just sit at home and cry and feel sorry for yourself now. This is no way to live. This is not living. This is existing. We've got to get you out and about. She would fight me on it and fight me on it and fight me on it, but there was one thing I knew I could always get her to do, and that's get in the car and go for a ride and get a Whopper. Burger King Whopper is her best friend. She will not, even if she is in the absolute worst mood there is, tell her you're going to take her to Burger King for a Whopper, and she's happy. That makes her day. So it all takes to learning what will bring them back around when they get to that point. But they can reach a point of apathy. And if they reach a point of apathy, they don't care about anything. They don't care about getting up in the morning. They don't care about getting dressed in the morning. They certainly don't care about bathing. They don't care about eating. They just don't care about anything. And she's gotten to that point a couple of times, but it's been when she starts dwelling on the fact that all of her brothers and sisters have died, that her mother and father are gone, that my father's been gone 7 years now, and they were married 51 years. You know, all of that, when she starts dwelling on that, and sometimes I'll call her and she'll just say, I've just been crying and I don't know why. Some days are like that. So it just all depends. But I hope you're seeing how it can be missed. And that is because some of the symptoms look so much alike, and then some are so different. And that's why it's so important. There's usually a missed stroke somewhere if they miss vascular and miss Alzheimer's. Now, Alzheimer's I should have recognized in my mind with my mother immediately because I saw the CT that said she already had moderate atrophy of the brain, that she already had hydrocephalus, which is too much fluid in the brain because there was not enough mass there to fill it. So, to me, that should have been the first diagnosis. But they said no, she did not have Alzheimer's. And I'm like, how can she not? Her mother had it, her sister had it. It obviously runs in the family. And they said, no, she only has vascular. I scratched my head and scratched my head and scratched my head because I'm like, this just does not all fit. Does not all fit the puzzle. Because I know that out of all of the long lasting symptoms, those go along with Alzheimer's. People with Alzheimer's live a lot longer than people with these other types of dementia. So keep that in mind as well. Now let's get to that picture that I showed you. I was going to go over about somebody that has had a clot in their brain and exactly what it looks like. Because I want you to see this on a CT scan, okay? All right. When you have the two together, this is what the brain might look like. You see on the vascular side, all of that dark shading on that one side of the brain? That's all from a clot. That is all dead tissue. Whenever it gets really dark and shadowed like that on the you see on the left hand side, that means that a clot has killed all of that tissue in the brain. Now you can draw an imaginary line down that picture of the brain, and you see that area that's on the right hand side where it looks like it has a little squinched up eye and then it goes down around the side like a little S. Well, you should have a mirror image of that on the other side. You don't. So that means that person has so much swelling going on in their brain that there's been what they call a midline shift, because there's supposed to be a midline going down the middle of the brain that you're supposed to be able to visibly see. And you can see from the CAT scan here that that midline is obviously off, and it's off due to swelling from the injury in the brain from that clot. All that dead tissue is causing a bunch of swelling in the brain. Now, on the right-hand side, you have your beta amyloid plaques, and you have the neurofibrillary tangles that are like the little Y, the upside down Y in this picture in between the cells. Those tangles and the plaques are the Alzheimer's part of this. So just think about it. You've got somebody that has this shadowing in the brain from having some kind of an event where they have some kind of vascular blockage of the blood vessel in the brain. And then you have somebody that's got these plaques that are in between all of the cells, and the tangles that are actually inside the cells that are preventing that cell from getting nutrition. Now, the plaques confuse things because it's like they mess up the transportation system. And the tangles mess up things because they just block it from getting where they need to go. So, between those two things and then having a vascular event on top of it, that's why these people end up having so much problem. And it's why it's so difficult to be able to diagnose them as just having one or the other, because there's so much overlapping. All right, so now we're going to go over Alzheimer's and Lewy body. Now, what do you remember about Lewy bodies? Lewy bodies start out in the what part of the brain? The substantia nigra part of the brain. They start out there with Parkinson's disease, and then they spread to other parts of the brain, which is why Lewy body dementia presents itself when it starts showing up other places. So it's often a misdiagnosis associated with Parkinson's. Now, remember, we said usually the golden rule, that's not really a golden rule, is that you have to have the symptoms of Parkinson's for about a year before you start showing signs of Lewy body dementia. Not always the case, but that's just the general rule of thumb. So let's go into the different signs and the symptoms with these, shall we? All right, some more of the symptoms of Alzheimer's. Remember some of these: difficulty concentrating and thinking, especially about numbers and abstract concepts. Do you remember this? Do you remember how it can kind of overlap with vascular, so you don't kind of know which one is going on? That's why that neuropsychological evaluation is so important, so they can see exactly what's going on, in addition to seeing the pictures on the CT and the MRI. Multitasking becomes very difficult and becomes challenging to manage finances, balance checkbooks, and pay bills on time. Remember how I told you my mother did away with balancing a checkbook, and I found where she had been writing everything down on a notebook ever since 2015? It's amazing how they hide things from you to try to cover up that they've got a problem instead of just admitting it and saying that they need help. They just hide it for so long. Then eventually this progresses to an ability to recognize and deal with numbers at all. We're having that problem now because she cannot recall at all anything about doctor's appointments, but yet she wants to try to keep track of it. So she has a calendar, and all she does is just try to write down the times of her appointments and the doctor's name if she can remember it. But she still wants to try to keep track of that information if she can. But the facility where she's staying keeps track of all that for her to know to have her ready whenever I come and pick her up. Ability to make reasonable decisions and judgments in everyday situations are going to start to decline. Remember, I told you how she started donating to everybody that was asking her for a donation that came in the mail? I'm still dealing with that nightmare to this day, and she has been in the facility for, since 8 months, since February. And I'm still finding new organizations that she's donated to, and they're sending me stuff. It's time for our annual drive. And I'm like, great day. How many of these places did she send money to? But anyway, when they start doing that, or you notice uncharacteristic choices in social interactions, remember I told you about my grandmother too. She was getting involved with psychics, had actually had a bag packed, and was getting ready to go to Miami when my family stopped her because she was convinced by some psychic that she had property down there. And that's how they found out with her that there was a problem. Burning food on the stove. Remember how I told you my mom just quit cooking altogether? She just would not cook at all. She had me go and get her meals every day, which was fine because I was worried that she wasn't eating at all because she just didn't seem to remember that she was hungry or didn't remember how to fix herself something. And at least I knew one meal a day she was going to eat something good. I stayed over there with her as long as I could until she ran me off every day. So you help them out as much as they can until they run you off. Unexpected driving situations. Remember I told you how she drove down the wrong side of the road and I couldn't get the police to do anything? Oh, she still has her valid license. There's nothing we can do. Yeah, that's when you go to the neurologist or you go to the family physicians and say, hey, we need a dementia driver's test because she doesn't need to have a license. So you have to sometimes do that in a roundabout way when they want to keep driving. Because I guarantee you, she didn't pass the driver's test. I was glad of that. All right, now let's talk about how symptoms of Alzheimer's could get mixed up with Lewy-Body. Visual hallucinations of shapes and people, animals. They start talking to themselves because they're seeing things that you're not seeing. Don't try to tell them they're not there. You can run into all kinds of issues if you try to tell them that they're not there. Just watch Tipa Snow. She has some videos on YouTube that talk about how you handle somebody that's having hallucinations, that's got dementia. She's got some wonderful tips on there on how to deal with that, especially if you got somebody that you cannot bring back to reality. She's got some ways to distract them and redirect them and get them back to where you can at least control the behavior a little bit. Movement disorders. You have the Parkinson's going on, and there's movement disorders that develop with the Alzheimer's as they progress. Poor regulation of body functions. They start having problems with dizziness. They start having problems with constipation. Then they can start having problems with incontinence. So cognitive problems with them start to develop a poor attention, not being able to stay on task. Visual, spatial, they can't tell how far something is. This is why they have the shuffling gait. They can't tell exactly how far and how high they're supposed to lift that foot up to be able to be sure of their next step. They start having problems with their memory. Short term first, always short term first, and then long term goes. They start to have sleep difficulties. They act out in their dreams. This is when one of those EEGs become very helpful. They can do a sleep study and pick up their acting out in their dreams. That's why they never feel rested. They've spent their entire night fighting in their sleep. And you don't want to be in the way of those fists when they start throwing them either in their sleep. That's why my parents started sleeping in different rooms, remember? Fluctuating attention. They get drowsy in the daytime. It's because they fought all night long. They have periods of just staring off into space. They can take really long naps. They get depressed. They have inexplainable grief. They call it the blues. Or they can have total apathy, loss of motivation. Do you see all of these things and how they're just kind of overlapping and why it would make it difficult to be able to make an appropriate diagnosis? If a person has Parkinson's, you know eventually they're going to have Lewy-Body dementia because all of that Parkinson's is just concentrated in that one part of the brain. But as it expands to other parts of the brain, it's not just the movement that's going to be affected, it's going to be everything else. So just keep that in mind. Because once Lewy body starts presenting itself, things decline rather rapidly. This is the form of dementia that seems to take people the fastest. I've had two people in my family that have had the Lewy body, and both of them were gone within 8 months. The Lewy body, I don't know what it is about it, but it just seems to be so much more aggressive than the other types. Okay, now remember that Lewy bodies only show up post-mortem after they've been stained. So really the only way that we can see them is after they have been stained. So in a brain of somebody that's got two types, Alzheimer's and Lewy body, you've got the tangles, you've got the plaques, and you've got the Lewy bodies that can't be seen until after death. So this is what their brain is dealing with. And you see the symptoms are starting to overlap with the different types. And that's why it becomes so crucial to have appropriate testing done to be able to get a correct diagnosis. Because remember, we said if a person has Lewy body, they can't take all of the medications and stuff that a person with Alzheimer's would take. Remember, we talked about that. A person that has Lewy body cannot take Aricept, which is one of the medications for Alzheimer's. And that's why appropriate testing and diagnosis is so very important. And now we're going to go on to the third type, which is one of the least common. And it's a combination of Alzheimer's, vascular, and Lewy body. So we're looking at problems with Alzheimer's, some kind of ischemic problem causing issues with blood flow in the brain, and Lewy body dementias, all three at the same time. So you're looking probably at a missed Parkinson's diagnosis, or you're looking at somebody that has Parkinson's, but they've never been told about the Parkinson's dementia. And to look for signs for that. Because let me tell you something, when you're dealing with somebody every day that has a medical condition like Parkinson's, when they're declining and you're seeing them every day, you don't notice the subtle changes that you would begin to see with the Lewy body dementia. It would take somebody coming from the outside to start to notice those changes because they can be very gradual. They can be very abrupt too, but they can be very gradual. All right, now remember with Alzheimer's that routine activities become more of a struggle as the disease progresses. Dressing and bathing and everything becomes more difficult. And it does as well with Lewy-Body, but we're going to get into that. Personality changes also become a part of Alzheimer's, and they can with Lewy-Body as well. You can see problems with depression and apathy, of course. You can see problems with social withdrawal, with mood swings. They start to distrust other people. They start to get really irritable, really aggressive. They have a change in sleep habits. They start wandering at night. Remember we talked about sundowners? How the sun comes down and they goes down and then they become alive. Loss of inhibitions. Remember we talked about people not ordinarily running around naked outside. Delusions. Somebody is trying to get them or out to get them or is trying to steal from them or something along those lines. They become very paranoid. They start thinking things have been stolen when in fact they have misplaced them is one of the main ones. And remember I told you my mother charged the recliner. She forgot she recharged the recliner. Then she accused me saying that I had charged the recliner to her account. And I'm like, no, we're going to go to the furniture store right now and straighten this out. So just keep that in mind that things can get really dramatic when you start dealing with all of these different things. So this is another portion of the Alzheimer's. And you can see how even some of the symptoms of this overlap with the vascular. And that's why it's so difficult to pin them all down. Okay, so let's talk about this. How could a person have these three kinds of dementias and not know it? Well, a person could have Alzheimer's. They could have Parkinson's and not know it if their Alzheimer's has already progressed to a point that they're having problems with movement. If they start to have problems with Parkinson's type symptoms when they're already having problems with movement, then it stands to reason that you might not pick it up right away. Then, if you take that and make it to where they can't really move that much and they become wheelchair bound, and then they develop a clot in their lower leg and throw it to their brain, then you end up with a vascular problem. And you're not going to know it until they start showing signs of a stroke. So what are you going to do? Take them to the hospital. You have them to have the CAT scan done to see if they have a clot. Oh, but that CAT scan doesn't show that they have a clot. It doesn't show that there's anything really wrong other than they got some atrophy in the brain from Alzheimer's. So what are you going to do? In 24 hours, you're going to do an MRI to see if there is brain damage showing up from a clot that they didn't know was there. Because what did we say? That damage from a clot's not going to show up right away. That is why in the United States, if you are within 3 hours on the first onset symptoms of a stroke and you don't have any kind of history of GI bleeding or anything like that, you go to the hospital and they can give you a clot buster that can make all of those stroke symptoms resolve. But you got to be there within 3 hours of first onset. And a lot of people miss that because they dismiss it as something minor. and they don't come on to the hospital. Or they wake up and have their bodies paralyzed, and you don't know how long they've been that way. So there are many reasons that people can miss the diagnosis, but for these people, I really feel bad for them. They got 3 different types of dementia: Alzheimer's, vascular, and Lewy-Body. And it's very unfortunate because it just means the decline is going to be that much more rapid. And with all of the dementias, we talked about how it basically is just a shutting down of the brain. In this particular scenario, you've got 3 different types that are working on shutting the brain down. So it's very sad indeed. So let's go on, shall we? Now, I hope in going through these presentations on the different mixed states that you have a better understanding about how difficult it is for diagnosis and treatment of these. And if you need to refer back to the information, all of the presentations are there for you, from Alzheimer's and Lewy body and for the vascular, as well as the frontotemporal. All of those are there for you to go back and reference. And there's probably some mixed states with the frontotemporal that get missed too, because it just gets lumped in with other behavioral type dementias. So it's important to go back and refer to that information for the coping and support information and all that if you need it. Please remember that Teepa Snow is her website is there for you if you want to refer to her. She's got a conference coming up in November that I plan to be a part of, the PAC conference, which means Positive Approach to Care. She teaches you classes on how to deal with people that have dementia. She taught me patience because I did not used to have the patience that I have now because I did not understand the way it affects their thinking. Once Teepa went through it, because she's worked with these people for 30 something years, and she explained how it affects the way that they think, you start to understand the world from their perspective, and it just opens up the world to you because you're seeing something that you never even saw before, the world through their eyes. So please look up her information for that conference if you're interested in taking some classes. I'm going to be there. The conferences are free online. They don't charge anything for them because you don't get the full benefit because you're not there in person like you would be if you were there at a certain place with them. So they don't charge for them when they're online, which is wonderful because you don't have to worry about an admission price. You can just go and get the information and you can sit there in your pajamas if you want to. But anyway, y'all don't forget to like and subscribe on your way out and consider following me on Patreon on my channel RN for a Healthier You. I'm still up right now on YouTube, but don't know how long that's going to be because they are censoring all of my friends left and right. They're losing their channels daily. So if for some reason I'm not there one day, you'll know why. They decided to censor me too. So anyway, I just wanted to put that out there. You'll always be able to find me somewhere as RN for a Healthier You. And you can either find me on YouTube here or you can find me on Patreon. I'm also on BitChute, so, and Brighteon.com, and the UtahGunExchange.com also has a website that I post my videos to. So UGETube, YouTube, Brighteon.com, BitChute.com, and Patreon.com. You can find me all of those places. to contribute to my work, it's either through Patreon or through Subscribestar, either one of those. But I just want to thank you for being here. I hope you learned something from this presentation. The next focus of my studies is going to be on a topic that not many people talk about. And I think it's one that needs to be educated on, and that is amyloidosis. So we are going to tackle that monster for the next few weeks. It's going to take several weeks to get through that information because it can be very confusing because there's different types. And we're going to go over that. So that'll be the next bear that we tackle. I hope y'all have learned something and y'all have a great weekend and we will see you next week. God bless and take care.